Do you see any scope for your device or tool with clinical trials?
Absolutely, and we do have a clinical trial offering, and part of that is the use of patient voice reco or speech-to-text transcription of patient diaries. So we're actually currently doing a number of clinical trials with CROs and pharmas to get both to improve adherence or increase adherence to the medication that's being trialed, and number two, to gather real-time patient-reported outcomes that are typically more statistically valid for two reasons. Number one, patients respond at the time of action to the question of how are you feeling, are you experiencing any adverse effects, are you experiencing anything different today. They do it in their own language, in a secure way, through a voice call, which is, by the way, HIPAA secure, and patients or people tend to be more honest when they're speaking to an interactive voice response tool, as opposed to being judged or by a clinical coordinator, for example. So combine those two facts, absolutely. We are currently providing a number of clinical trial solutions and have case studies that we can talk about as well with those.
What do you see as being the biggest challenge to penetrating the U.S. market?
The biggest challenge to entering the U.S. market, I don't actually think there is a real challenge to entering the U.S. market. It's for us, it's more of an open market in terms of adopting technology and innovation into healthcare. Our experience has been that we can break down the barriers in an organization quicker, not break down the barrier, but we can actually get further into an organization faster because things like innovation are funded in the U.S. There's more of a realization that there has to be a 5-year plan or a 3-year plan or a 7-year plan to look at things like accountable care, to look at things like star ratings, to look at things like actually devoting resources to issues like patient adherence, medication compliance, and mHealth. There's a lot of one of the issues with the American market that I can talk about is just the sort of Wild West nature of mobile health right now. There's so many apps, there's so many claims of security and what's secure and what's not, and really what we like to do is take a step back from that in terms of, okay, so there's the functioning app or a functioning system is the ticket to entry to play in this game. Once you have that, that's great. You now need to be able to manage and integrate into the healthcare continuum to actually be able to recruit patients, keep patients on programs, and to get beyond the low single digits of penetration when we're talking about mobile health apps. So yeah, there are challenges, but these are not insurmountable. It's just the timing and the sort of Wild West nature of early adopters and innovators in the space.